Hepatitis is a viral infection. There's a low prevalence of hepatitis in Ireland, but for those people who become infected with hepatitis B or C, it can be very serious because it affects the liver. There are 3 types of hepatitis: hepatitis A, B and C. Hepatitis A is associated with poor hygiene and sanitation. It's likely to be contracted through contaminated water and unhygienically prepared food. If you do contract hepatitis A, you're likely to feel unwell with vomiting and diarrhea, but it will clear up within a few days without any treatment. Hepatitis B is a vaccine-preventable disease. The problem with hepatitis B is that it's highly contagious and it is present in many bodily fluids. The most likely way to pick up hepatitis B or C is through blood products, as in sharing needles. You can also pick up hepatitis B through unprotected vaginal, anal or oral sex, mother-to-child transmission or poor sanitation and hygiene. 50% of people who are infected with hepatitis B have no symptoms. Other people have very severe symptoms, which include jaundice, which occurs between 1 and 2 days after infection. The treatment for hepatitis B is to rest and take it easy, and in some people you have to stop or reduce the amount of alcohol you drink. Most people within 6 months will have got rid of the hepatitis B virus and become immune. In those people where hepatitis does persist, it can go on to develop cirrhosis or cancer of the liver. There is an effective vaccination for hepatitis B. For hepatitis B and C, try to avoid blood and bodily fluids. Always use a condom. Do not share needles, razors or toothbrushes. That is, any object that may be contaminated with blood. Hepatitis C is primarily transmitted through shared contaminated equipment when injecting drugs or through getting unscreened blood or blood products. It can be transmitted through sex or mother-to-child transmission, but this is much less likely. The majority of people who contract hepatitis C have no symptoms, but it can't be got rid of, and some people can go on to develop cirrhosis, liver failure or liver cancer. In order to prevent picking up hepatitis C, do not share any equipment that you think could be contaminated with blood, even dried blood.